Another common argument is the slippery slope argument. In philosophical circles, they kind of use another term, the wedge argument. Most of us haven't heard of that, so we'll just use this slippery slope argument. We've heard of that. If you allow this thing, then later on we'll be doing things beyond the scope of the thing we kind of allowed, and things will keep on deteriorating. Allowing this practice of hastening death, even if you put restrictions, like you can only do this for this small, limited set of patients, very terminal, you're really suffering, you've done everything that you can to take out this suffering, then it's justified. Now, if we come up with a very restricted and very acceptable set of parameters, like this person is close to death and there's no way to stop the death, and the person is suffering so much, and the person is begging us not to do anything to prolong his life any further, just stand back in so that the death will come faster, or stop this so that death will be hasten death, right? We can even put the restriction, and this is a very important restriction, is the patient knows exactly what's happening, and the patient saying, I don't want it anymore. So that's autonomy, self-determination. Or the patient can't speak anymore. Most of the time the patient can speak, and that's the case we're dealing with, and the family's saying we're speaking for the patient, and assuming that's true. And so that's the big question mark. Then it's perfectly justified, or it's justified to proceed. So hastening death is okay, or causing death is okay by withholding something. Withholding the treatment that would prolong life is okay. So if we're restricted to that, then it's okay. But then the argument is you just entered a slippery slope. And then later on you'll say, well, what's suffering? Before, we're just looking at this person and it's shouting in pain, and we've done everything that we can think of to prevent the pain, and the person is still in pain, and therefore it's justified, and therefore it's okay. Proceed to end life or proceed to hasten death. That's okay. What about the other kinds of suffering? Different. So you can say that's not much pain, but maybe for this person, the pain, the fact that he's dying and he's feeling bad, he's feeling sad, he's feeling depressed. Even if you ask him, he cannot take it anymore. And we've done everything that we can, as far as we're concerned, to minimize the suffering. Then it's perfectly justified to proceed with hastening death. Now, of course, there are several big question marks there. In philosophical writings, you don't see the big question marks because the people writing are like ethicists. I mean, they're not doctors. Some of them are, but their conceptualizations there and their reasoning are up here, and there's a huge distance. I mean, it's very scholarly and very well thought out. And I think the reason why it's very sophisticated and scholarly and well thought out is because they pruned out the complexity and made it simple enough to discourse in a very rational manner. But real life, real world situations, the person in front of you, the family who's talking to you, they're as complex as you can get. And so those things we pruned out while doing this very scholarly debate or writing this very scholarly piece of paper. Now we're faced with the thing that actually makes the problem complex and very, very human. So we bring everything back, belief and everything else. And the complexity also would influence some of your assumptions. We've done everything that we can to relieve the suffering. But then you're talking about doctors who are thinking they've done everything that we can in an institution which pretty much took out or decreased the sense of importance of the subjective and the spiritual. Even the of psychosocial or psycho-emotional is pretty much decreased, right? We have psychiatry and the clinical psychologist, but in our everyday hospital life, even if the condition of the patient tells us that there's a lot of psychosocial and psycho-emotional factors involved, which is probably heavily influencing the very physical and the very biomedical stuff that we do. But us, the doctors managing this patient, for the clinicians, how much value do we actually give the clinical psychology or counseling and things like that? We can say, well, we do, but the actions speak louder than words. How much of the stuff that you do tries to address the psycho-emotional, psychosocial relative to the stuff and the effort and the time you spent trying to do the biomedical? Because that's the way we think. That's not our job. Our job is the biomedical, and that's pretty much the end of the story. Says who, right? So that kind of idea has only been around for the past 50 to 100 years. For centuries, that wasn't the case. Doctors or physicians take care of the entire person, and you're not restricted to the biomedical and the stuff that you consider scientific. And that's relatively new. You can argue that, it brought advances in cure, but did it do the same thing for caring or for being humane? We won't go into that, but that's the question you can ask. Because the argument is, by taking this stance, you were able to cure a lot of diseases. But what else happened when you took that stance? What about caring and compassion? How did that go? Did you wipe it out for the sake of curing or postponing death? How well did that do as far as caring and compassion, especially for people who are terminally ill? So was it also a positive effect? Another big question mark would be, and the person really wants it, autonomy. And then, of course, we look around. We look smart right now because they've talked about these things like more than 50 years ago, and this is 50 years afterwards. We have the informed consent. We're doing all these things. We've justified certain actions along those lines, withhold this or that if we have this certain set. We've done that. And the assumption is doctors and the medical community, the society in general, is very rational and very humane, guided by good values, and they won't go down the drain. And of course, the question is, how are we doing? The requirement is we're upholding the patient's right to self-determination. So how are we doing along those lines? Well, if you look around, you might think that it's really not the case. I mean, sometimes the motivation to just have this patient disappear or get this patient out of the hospital is a lot stronger, and we'll just use the arguments from decades ago to justify doing so. Informed decision-making is not informed decision-making because the way the information was presented is skewed towards the person accepting his faith. It's skewed towards convincing this person to go home. It's not very neutral. I can think of several reasons why that would be the case. If you have someone who's terminal or dying, you don't order a lot of tests for a dying person. Not a lot of your big, expensive, paid by insurance or paid by out-of-pocket diagnostic tests. And of course, it's also troublesome for this consultant. I mean, you go in, you're trained for cure, you think biomedically, and you're looking at someone who's dying. There's not much you can do. Every day, it's a sense of hopelessness or helplessness as far as this consultant is concerned. There's no ego boosting anymore. Nowadays, a lot of doctors don't find an ego boost with compassion. Like, oh, I showed compassion, I was caring. It's more like, I solved the problem. Because that's how you were trained in school. We don't congratulate you for being compassionate and caring. We congratulated you because you looked through the journals and the references and you gave the right order for the diagnostic testing, the order for the right medications, or you decided rightly on the procedure or surgery that you did, and that's pretty much the end of the story. And that's how we wired your brain. Not a lot of ethics or subjective stuff going into that, right? So the slippery slope. And the argument against this argument would be, we're not talking about the bad things that might happen in the future. For one thing, how can you predict those things? I mean, you're just assuming. I mean, we cannot even argue about them because, those are things that might happen. They haven't even happened yet, and you're not even sure whether they'll happen or not. So that's the argument. Of course, that argument can go both ways. You're also not sure that things will turn out well, right? What makes you so sure that things will turn out for the better? What if it really caused a downward spiral and we find ourselves in a really, really deep hole? And even if we regret doing the thing, we cannot get out of it anymore. The other side will say, well, both of us cannot predict the future, and we're trying to come up with a solution to the matter, so we don't bring in stuff like that in a very rational discussion. Uncertainty is no part in a rational discussion. No, but that's not true. Uncertainty is part of everything. But, things won't be clean if you have uncertain, and things are uncertain. And, the reason why some ethical papers look nice to read and clear cut and, it's convincing is because they don't consider the human psyche, and they don't consider the historical precedent, and they don't consider a lot of uncertainty. That's why it looks clean. But that's not what the real world looks like. All these concerns were happening 50 to 100 years ago. So now we actually have more proof. During that time, they can actually foresee it. They just don't want to talk about it. Now we have more proof 50 to 100 years later. So what happened? How were things going? Are we improving and advancing as far as the practice of being more humane and moral is concerned? Or are we deteriorating and misusing our policies based on these things we try to morally allow or justify? Are we using these policies well, or are we causing a lot more suffering to certain segments of the population using the justifications provided by the policies we created? Now it's up to you to answer that, right? Now I can tell you one glaring example would be listing about home against medical advice, right? So, this is obviously bad. Even if you go to the most agnostic, most non-religious part of the United States, any ethicist and lawyer will find this wrong. Now, if you go to a developing country, a westernized country, and of course you already have a clue. If you go to a developing country trying to be westernized, that's also the problem. Some of these countries have a sense of lawlessness. Just watch them, how they manage their roads. The laws are there. It's like they show you the laws, the traffic rules and regulations, and it's firm. And those things are usually, if they're trying to be westernized, especially in the metropolitan areas, they copied it from the West, right? So it's pretty strong, but they're not following it. And the answer is, those things are just guidelines. You try to follow it, but then you look around and nobody seems to follow it. And then the question is, if the laws aren't followed, but more the ethical guidelines. Now, what more if you go in a place who says your ethics is your ethics and my ethics, and that's their belief, and it doesn't necessarily mean I should follow their belief, and everything's just a huge mess, right? So now you try to figure out, in this kind of context, is the chance of entering a slippery slope very likely? Is it already going down the drain? So you read through the texts during that time, how careful they were in trying to implement justified hastening of death. They're very careful. It was very controversial during that time. And look at the way we misuse and use, how we became very liberal in applying that ethical justification. And the question is, have we corrupted more young minds, and have we hurt more people right now than before? If you get people from 50 to 100 years, even the proponents of justified hastening of death would cringe at what we're doing right now. But if you ask the people right now, some of them will say, this part is not good, but this part makes sense. Even the part people from 50 years ago won't accept. That's one way of showing that it's really a slippery slope. Of course, some people will say, well, if you put everything and subject everything to reason, reason is not everything. A lot of human beings don't act based on pure reason alone. They really do have a tendency to misuse these kinds of ethical justifications. or they do have a tendency to act in a very irrational manner. And if it's not reason, then what else is there? That is the reason for the downward spiral. Now, of course, if we go down that road, then we'll enter the idea of whether a person is inherently good or bad, and of course you enter the domain of religion, and we can certainly go into that, but this session is already taking too long, and we'll just talk about that some other time. So that's slippery slope. So we shouldn't consider that. We should trust the human person. When the bigger problem comes, then we should trust that he'll come out of it okay. Of course, that depends on how you view the human psyche, or how human beings act. Maybe if they act very rationally and very humanely, that would be very possible. Now, there are other things attached to this argument of slippery slope. The idea is it's a slippery slope because once you do these things, then you sort of degrade the idea of suffering and death. People in the West, they've gone really far down the road, but in the less modern places, more traditional places, they know that death, life after death, suffering, these things also belong to religion, right? So our spiritual beliefs. These things are not completely negative. In Judeo-Christian, Christian, and Catholic beliefs, these things are positive. That's the reason why most priests, when I say something like, we should prevent all suffering, they kind of try to correct me and say, you should prevent physical distress, forms of distress, if the person is asking for it. But don't say suffering, because, when you talk about suffering and you look at the scriptures, Judeo-Christian, Christian, or Catholic scriptures, suffering has a very significant role. It's an important part of their belief, and it's not at all completely negative. Well, we took that out. So the idea is, we took those things out, and now we're doing stuff based on an environment without those beliefs. So suddenly, the human being, life is not sacred, so there's no sanctity of life. Suddenly, there's nothing to look forward to after death. And suddenly, there's no clear ethical absolute. And everything's secular. Compared to how it was before, where everything's clean and clear, now we find ourselves in a very dark, murky place. That's how it will feel. Of course, if you talk to the ethicists and philosophy students, or the ethicists, bioethicists, and philosophy students in academic centers, it's clear you're just not studying enough. Because while you're doing it, it doesn't look clear. It looks like you're heading somewhere. But to an outside observer, which is like more than 95% of the population, everything looks murky. You look at what they're talking about, and they look like they're not completely applicable or easily applicable to the real world. It's like nice, rational debates. But the reason why it's sophisticated is because they pruned it and made the concepts, the conceptualizations controllable or manageable. It's really dark and murky, and kind of wading through, and things are so confusing. Even the people debating about ethics are confused themselves. They agree to disagree, and that's pretty much how far they've gone. And if you ask them, so how are those things doing right now? That's not their concern. Application of what they thought of, that's not their problem. It's not their responsibility. It's really a dark, murky place, and there's an absence of light. If you ask me, well, why do you feel like there's an absence of light? Well, there's something you took out. Now, of course, if you bring back, you shine the light back at it, people will squirm. They see their behavior and their value systems in a different light, and so they don't want it again. Or secular, just get that thing away from me, right? So I'll stop there.